Kirk Furlotte. He holds a Master's of Arts in Health Promotion from Dalhousie University, where he completed his thesis looking at perceptions of the end of life of older GBMSN. He had worked in queer and trans health research and advocacy through a number of Halifax organizations. And as the regional manager for CBRC in Atlantic Canada, he seeks to increase access and uptake of combination prevention strategies related to HIV and STTBIs. Kirk's work involves collaborating with community-based organizations, service providers, and key stakeholders. He continues to research through projects on advanced care planning and long-term care needs for older LGBTQ adults. Welcome, Kirk.
Thank you, Jose. Good morning, everyone. I'm here to talk to you about Advance Avancée in Atlantic Canada. So I've been working with CBRC since the spring. Our team also includes Dr. Matt Newmer, who's hiding at the back. He's Professor of Health Promotion at Dalhousie University and is our regional advisor. We'll soon be joined by regional support coordinators and community trainees hosted in partner organizations across the region. We have one, Charles McDougall right there. Wave, Charles. There he is. Thank you. So let me tell you a little bit about Atlantic Canada. We are 4 provinces on the traditional lands of the Mi'kmaq and Beothuk people. We're all rather unique and mostly small in terms of population. Fun facts about each province. New Brunswick is the only officially bilingual province in our country. Nova Scotia has a high student population, 3 times the national average in our capital city. PEI has the first openly gay premier in Canada. And Newfoundland and Labrador has their own time zone. There are no organizations in Atlantic Canada that are specifically focused on LGBTQ men's health. Just 1.5 position at the AIDS Coalition of Nova Scotia, and me. Our population is approximately 2.3 million, and of those, 40 to 55% live rurally. And when I say rurally, I mean in communities of 1,000 or less, so pretty rural. To give you a better idea of what things are like across the region, I've prepared some comparisons. So Nova Scotia is our most populous province, although Newfoundland and Labrador is the physically largest. Our provinces do tend to skew older than the national average. Lots of younger people leave for the big cities. I was one of those at one point, and I came back. Estimates vary, but in general, lots of Atlantic Canadians just don't have a primary care physician. Healthcare, as in most Canada, is delivered by health authorities, and those vary as well. We've seen some amalgamations recently. New Brunswick and Nova Scotia both recently merged some of their provincial health authorities. New Brunswick went down to 2, and Nova Scotia went down to 1, overseeing the entire province. And as a Nova Scotian, let me tell you, that was not a smooth process. Politically, most of our governments are liberal. Well, now. You may have seen in the news recently about the drama in New Brunswick, where we had a liberal government. They didn't entirely win the election, and then they lost a vote of confidence. One thing you do need to know about Atlantic Canada is there's just not a lot of funding for HIV or STBBI work. For example, if you're applying for Public Health Agency of Canada grants in Atlantic Canada, you can ask for some overhead costs, whereas that's harder to get in most other regions because they know that there's no funding for it in our region. So what do we have? Well, no point-of-care testing at all, really. The asterisk is because there is one organization in New Brunswick that's going to start a once-a-month point-of-care testing site point-of-care testing night at one site in the entire province. We don't have, it's not on the slide, but we don't, anonymous testing is quite limited as well. We only have 2 sites in Nova Scotia, which is actually down from 3 a few years ago. Coverage for antiretrovirals varies as well. This is a fairly simplistic version of what it is, but basically in New Brunswick, if you go through the provincial drug plan, you have a maximum copay of $500 per fiscal year, and if you're with social services, you get it for $4 per prescription. In Nova Scotia, ARVs are covered by the Department of Health and Wellness with a fixed copay of $10 for a 3-month supply per drug if you don't have private insurance. In PEI, it's actually 100% covered with no deductible or copay. And Newfoundland and Labrador, their system's much more complicated with 4 different options, and they range in income. They range in coverage based on income. PrEP coverage is a relatively new phenomena. Every province except PEI now has some limited coverage via their provincial drug plans, which are not the easiest to navigate, and they are often scaled to your income. Interestingly, when New Brunswick and Newfoundland and Labrador added these programs, they made no big press release. They just updated providers in some community-based organizations. Post-exposure prophylaxis, or PEP, is surprising and disappointing. In New Brunswick, for any PEP coverage, you need to have a pre-existing subscription to a provincial drug plan. And Nova Scotia will only cover PEP for non-consensual sexual acts. PEI will cover non-consensual acts and workplace, and Newfoundland and Labrador doesn't cover it at all, period. So who's filling these gaps when the provinces aren't? Well, we have several dedicated AIDS service organizations, although I've noticed quite a shift towards harm reduction and away from queer men's specificity. You note the asterisk. That's because we are fortunate to have Healing Our Nations, a Mi'kmaq organization focused on HIV, AIDS, and sexual health education operating throughout the region, although they are based in Halifax. New Brunswick has 3, as does Nova Scotia, and Prince Edward Island and Newfoundland and Labrador have 1 each. Most provinces have no central organization or advocacy group for advocating for queer or trans issues. Nova Scotia does, but it's become inactive as late, and I can say that as a former employee and director. But Pride is doing well. I'm not sure I truly captured all the prides across the region. We have lots of small community-based prides, and for paid Pride employees, I'm talking year-round, one of whom is Charles, who's here. We only have 2. My next category on my slide is a bit vague, but in Nova Scotia, we have the Provincial Advisory Commission on AIDS and Pride Health, which is a unit of the Provincial Health Authority. To my knowledge, none of the other provinces have anything like that. For example, there's no PEI, Center for Excellence in HIV and AIDS. But New Brunswick and Newfoundland and Labrador have clinics focused on queer trans health issues. Both were opened by practitioners who wanted to set up their own practice, and both focus more heavily on trans issues and have long wait lists. So what is the Advance doing in Atlantic Canada? Well, we've already got some amazing projects going on and in development. We support the Nova Scotia PrEP Action Committee, which is a grassroots organization educating and advocating on PrEP. We're doing education on PrEP to both the public and healthcare providers. We're looking to organize continuing medical education credit courses in Nova Scotia and PEI. We helped organize a public panel during Halifax Pride to educate the community about PrEP. We're also hoping to launch Smarter Prevention, which I think Brooke might mention later. And to keep track of how we're doing, we're going to use regional progress cards to track some key elements of our work. And for potential interventions, these are still percolating. A coalition of queer and trans health organizations in New Brunswick, HIV STBBI testing nights focused on GBT2Q men, a Two-Spirit Health Summit, a collaborative health center in Halifax focused on gender and sexual health issues, and online resources. Because again, we're fairly rural, so we need resources that can spread out fairly easily. And more, well, we're doing consultations across the region through formative research. I've met with a number of key informants, mostly in Nova Scotia, because I live there. But I'm hiring regional support coordinators such as Charles in other provinces to continue the work. This summer, we had Sex Now come to Halifax Pride. We managed to meet 2/3 of our target with one of our events canceled due to heavy and ongoing rain. We have a number of community organizations in the Atlantic region who are helping us to promote the online version of Sex Now, and I'll speak more about why we care so much about that in a moment. Through Dalhousie University, we're supporting a survey of doctors' knowledge of PrEP, and later this month, I'll be participating in a community consultation with the Nova Scotia Chief Medical Officer of Health and community groups in relation to PrEP. And finally, I'm hoping to launch an Investigators Atlantic in the next year or two to help do research on regional issues because being counted matters. Many of us know what it's like to be left out of the conversation. I don't know if you can truly appreciate how frustrating it is to hear people refer to Eastern Canada and mean Toronto. There are 5 more provinces after that, starting with La Belle Province. This actually came up in my meetings across the region often when Atlantic Canada is included, what people really mean is that Halifax is included. Because we're so small, it is hard to do research on us to get meaningful numbers. In the last Sex Now, 2014-2015, Atlantic Canada made up only 6.14% of the total respondents. So it's kind of hard to draw significant conclusions. And again, living rurally can make it hard for interventions and outreach, but we do want to be engaged. So for example, Sex Now at Halifax Pride, it was raining during our first 2 events where we hit our goals, and people lined up in the rain to participate because they really wanted to be counted and they really wanted to participate. Thank them, not me. So how do we address these needs? So it's a great question. I'm not entirely certain of the answer. We're still in the formative stage. I have ideas, of course, but we're looking to identify the needs through gaining a better understanding of the situation on the ground, through our consultations with community members, community-based organizations, and systems and institutions. And again, since I've already done some of this work, some initial results. Most key informants felt that there's very little knowledge of PrEP, even less knowledge about PEP, and very limited knowledge about U equals U. As I mentioned, lots of Atlantic Canadians are without a doctor, and then finding a culturally competent doctor who understands their needs, even more complicated. Because if you get a doctor, you just happen to have a doctor. Several people cited how lots of guys are still in the closet or just don't identify with terms like gay, bi, or queer. For those who do identify, we have limited social spaces. Halifax has one official gay bar, St. John's has one, and that's it. There are no queer trans community centers in the region. Fully funded, I say. We've got groups, but not fully funded. It's also worth noting, but both Nova Scotia and New Brunswick have seen a spike in HIV diagnoses this year. In 2017, Nova Scotia had 15 cases. By June, we were at 16 for the year. In New Brunswick, I couldn't find the 2017 number, but in 2016, they had 7 newly diagnosed HIV cases, and as of September this year, they had 16. So other provinces are seeing decreases, and we're seeing increases. But thankfully, we're not alone in this work. We have a variety of partners and stakeholders across the region to help us. In Nova Scotia, we've got the AIDS Coalition, the Sexual Health Nova Scotia, the Halifax Sexual Health Center, the Action Committee, Halifax Pride. In PEI, we're working with Peers Alliance. In Newfoundland and Labrador, we have PFLAG and ACNL. New Brunswick, we have AIDS New Brunswick and Moncton's River Pride. And across the region, we have Healing Our Nations and the Wabanaki 2 Spirit Alliance. So there is lots to do, but there's lots of passion for doing it. So I'd like to thank you, merci, and thank you all.